Tetanus. The unconquered. Road accidents, burns and injuries are the main high risk of tetanus. 68% had been involved in road traffic accidents. 1 million cases with moderate or severe burns reported every year. Around 75% accident and burn cases suffer minor injury. The causative agent of tetanus disease is Clostridium tetani. Bacterium Clostridium is an aerobic spore-forming bacterium whose natural habitat is soil, dust, and intestinal tracts of various animals involved in the transmission of tetanus. Infection begins when the spores are introduced into an injury or wound. The spores germinate, releasing active bacteria that multiply and produce a neurotoxin called tetanospasmin. It initially binds to peripheral nerve terminals and toxins transports within the axon and across synaptic junction until it reaches the central nervous system. Neurotransmission, also called synaptic transmission, is an electrical movement within synapses caused by the propagation of nerve impulses. These neurotransmitters are packaged into synaptic vesicles. GABA is an inhibitory neurotransmitter. Affects skeletal muscle function. The neurons which release GABA, the major inhibitory neurotransmitters, are particularly sensitive to tetanospasmin, leading to failure of inhibition of motor reflex responses to sensory stimulation. Without this control, chemical regulation of muscle relaxation is lost. It can be fatal when it affects the muscles used in breathing. Tetanus complications are trismus LoJack, dysphagia, neck stiffness, abdominal rigidity, opisthostosis. Marked muscle rigidity interferes with chest movement. Laryngeal muscle rigidity, causing unconsciousness or death. Tetanus is a life-threatening infection. Around 1 million cases of tetanus are estimated to occur worldwide each year, with more than 200,000 deaths. Medical management of tetanus. Treatment focuses on all wounds should be cleaned. Remove dead and infected tissues. Administer tetanus toxoid for active immunization and administer tetanus immunoglobulin for immediate passive protection. The incubation period of C. tetani range from 3 to 21 days. Active immunization. Tetanus toxoid alone is not enough at the time of injury. Moreover, TT takes almost 21 days for seroconversion and to reach antibody level. The effective treatment is prevention through immediate passive immunization by ensuring that protective levels of antitoxin are achieved. Bharat Serum and Vaccines Limited presents Tetglob, Human Tetanus Hyperimmunoglobulin, available in 250 IU and 500 IU, will help you in saving life. Tetanus immunoglobulin versus tetanus toxoid. Tetanus toxoid, TT, is given for active immunity which develops antibodies after 21 days. But the incubation period is as short as 3 days, usually ranges from 3 days to 3 weeks. TT will not provide protection during the critical window period. Whenever there is a new wound and when the immune status is not known or considered incomplete, Tetglob becomes a part of the management during the treatment for tetanus, which offers immediate passive immunity within 3 hours and takes care of the dangerous period for the first 21 to 28 days, which is of more concern because this is when the spores germinate under favorable conditions. Hence, it is very important to administer Tetglob immediately after a wound so that the patient gets immediate protection. USPs of Tetglob: provides prolonged and predictable serum 2 levels of antitoxin. It has a half-life of 4 weeks and shows to appreciable serum levels up to 14 weeks, less allergic or anaphylactic reactions even in one repeated intramuscular administration. The use of tetanus toxoid and TIG in wound management is important for the prevention of tetanus. Tetanus immunoglobulin is given as a part of the management of tetanus-prone wounds when immunity against it is unknown or considered incomplete. Tetanus Wound Management Protocol. The need for passive immunization according to WHO, CDC and IAP. Persons with wounds that are neither clean nor minor and who has undergone a history of prior TT vaccine doses should receive tetanus immunoglobulin along with TT vaccine. Bharat Serum and Vaccines Limited presents Tetglob will help you in saving lives. Available in 250 IU and 500 IU. For more information, kindly refer to the pack insert available on www.bharatserums.com.